Hello, and welcome to episode number 2 of Sports Therapy Extra, our new podcast where we introduce you to members of our team and regional reps. Today, we have Emma Wardle, who is one of our regional reps down south. Emma is a sports therapist based in Aldershot in Hampshire and an ex-national junior squash player. So without further ado, Emma, welcome.
Hi, Scott. Thank you. So I'm going to tell you a little bit about me today. I'm going to be doing a little bit of my background and history as a therapist, a little bit about my journey as a therapist, kind of looking through my sporting career and my personal kind of, not sure if I call it an injury journey, but sort of maybe a rehab journey and how it's kind of brought me to the therapist I am today. So Scott's already done a little bit of an intro about me. So I'm Emma. I'm based in Aldershot, Hampshire. I'm obviously with the STA. I'm one of their regional reps for the southeast of England. I think I joined them about 3 years ago, maybe 4 years ago now. And I actually, going to say this, but I actually tried to join the SST before I joined the STA, and I just tried to apply with them and I wasn't allowed to join them because of my university not being regulated with them. Wasn't with anyone before, and then as soon as I couldn't join them, I looked and joined the STA straight away. So yeah, I've been with you guys about 3 or 4 years, and I decided to get a little bit more involved with the regional rep role in March of this year. So obviously when clinics closed. And that's been really nice because it's been really nice meeting sort of other therapists in the area. I've made probably more connections as I work in a clinic by myself at the moment. So it's been really nice to connect with more local people. I'm an ex-national junior squash player. So not many of the reps will probably know that. So that was quite nice to do my talk on kind of a bit based around sport. And below, you'll be able to see on the About Me slide, I think Scott had it up, but I put my website, my Facebook and my Instagram.
I've got all your details on afterwards as well. So I've got all your contact details and everything on that we'll bring up afterwards.
So you guys will be able to have a little bit more of a look if needs be. So if I talk through a little bit about my background and history as a therapist, I graduated in 2013 from the University of Bedfordshire. So I've been a graduate sports therapist now for I think 7 and a bit years. My first 5 years I worked kind of within 2 clinics. So I graduated in sort of July and was thinking what everyone thinks about, I'm not probably gonna be able to get a full-time role. So looked at a couple of, part-time things. And then I applied for one of the David Lloyd clubs. And I started working there in November of that year and was full-time there really. So did 5 days and I worked alongside a physiotherapist, which was really nice because I think as starting off he was sort of my supervisor, so I had a bit of guidance if there was anything I was struggling with. And then really I kind of, after about 3 years of being full-time there, I started up a second clinic on my own, which was somewhere else. Again, just me working there. So I was working out of kind of a spa room in a kind of golf hotel, which was really good because I got to see lots of golf players, which was great. And then I've also had, I would say probably sport-wise, most of my experience has been in rugby. So I worked at 2 different rugby clubs and at Farnham Rugby Club, which was my second one. I was there the longest. I was kind of head of the medical side of things, so ended up looking after the first team, but kind of all the junior teams, ladies teams, kind of ended up just being a little bit too much of a big role for one person. And then the last sort of 2-3 years I've been running my own business full-time. At the moment, the place I'm in at the minute, I've got a ground floor clinic, so I've been here about 18 months, which has worked really well aside from the COVID stuff. So clients wise, I would say, I know people normally specialize. I would say apart from the rugby, I see pretty much everyone in my clinic. I've seen rugby, football, golf, to kind of marathon runners, ultra runners, And again, I see a lot of people who, again, aren't really that sporty, are quite sedentary, have desk jobs. So I've kind of seen sort of the whole range, I would say, male, female, sort of younger, older, work with kids quite a lot as well. That's kind of just a little bit about me. And then if I go on to my personal journey, so the links between my sporting career, rehab journey, and the therapist I am today. So if I start, a bit of a long one with my squash journey, but I got into playing squash from my dad. He always played, and I think from not really sure of an age, but whenever I could walk and hold a racket and get on court, my dad took me on court. So I probably started playing county level squash when I was sort of 10, 11 years old. And this is when kind of my my knee issues started to kind of creep up. I'd not had like any problems before that. It had only seemed to have kind of flared, you know, since doing something to quite a high level and training quite a lot. So I started off with bilateral knee pain. And at the time I didn't really notice, you know, that I was knock-kneed essentially, and I had flat feet and collapsed arches. I wasn't really aware of it at all, and I'm not sure my mum or family were really aware of it until I was on court with my coach. And I think there was a lady whose son was having a lesson after me, and I think she was either a physio or a podiatrist, I'm not quite sure which, but she told my mum after the coaching session that I was kind of overly pronating and I had collapsed arches and, you know, internal rotation of my knees, which I think my mum was kind of like, oh, maybe you know, should get, you know,
terrified.
get them looked at. Yeah. So she actually suggested seeing a local podiatrist at the time. I'll mention her because she's still working. I've actually looked her up to have a little look, so I must have seen her when I was 10 years old, but she's called Karen Knightley and she runs FMX Foot Mechanics Podiatry Clinic in Chobham. So I went and saw her, and I had to check a few details with my mum because I was 10, 11 at the time. But I do remember quite clearly having an assessment with her. I remember doing gait analysis on a treadmill. So again, barefoot walking, trainer walking, and then I think she got me to run as well. And obviously she played me back the videos, which was really interesting because it gave me, even before I qualified as a sports therapist, you know, a little bit of insight into sort of my mechanics. And basically the outcome was that she gave me a load of rehab exercises to help strengthen the areas that needed to. And I also had full length orthotics made for me, which was also really interesting because you obviously have a mold put on your feet. So I've still got them at the moment. I'll go on to that a little bit later because I've tried not wearing them, and yeah, I'll tell you a little bit about that. So I was advised to wear my insoles all the time and swap them from my school shoes to trainers and into my squash shoes. If we go on to the next slide. So again, this is kind of, I mean, this was really early, so this was 10, 11, but through kind of starting to, you know, climb into sort of my national stuff for squash, I think these two things really helped me kind of become a sports therapist, you know, learning a lot about my body and kind of the biomechanics, and the other side of it doing the rehab. So I kind of think at that age, I was thinking, I remember coming out from the session, actually probably a rehab and sports massage session I had, thinking I would really love to do that as a job when I'm older. I would love to be helping athletes, helping people overcome injuries, sort of that type of thing. So again, through my squash career, I didn't really suffer with many injuries or issues. Luckily, I'm kind of thinking if I hadn't got my feet seen to and I didn't have insoles, would that have been different? I mean, people might have their discussions on that.
You can never say, can you? You're not going to be able to know now that if you never got the insoles, whether you carried on having the pain or not.
Yeah, and I know some people, there's obviously a whole discussion on insoles now, so that's kind of another chat, so we won't get into that. But regular sports massage I found really helped kind of my body with the high amount of training I was doing. So again, that was like another insight into being sort of into the sports therapy world or sports massage world quite early on. I was introduced to stretching at a young age. So, you know, I come across, for example, I had a 17-year-old client the other morning, and I think he's quite sporty, but again, he's quite at a low amateur level. And it surprises me how many kids aren't really taught about stretching, and they're doing quite a lot of high intensity training, but they have absolutely no clue on stretch stuff. So that was really interesting for me, because I had a coach, and I had someone that I went in the gym with as well. So looking at weights, looking at rehab, looking at strengthening stuff. So I was kind of introduced to that really early on. So a little bit of extra info about me. I'm hypermobile and quite lordotic as well. So I've kind of done quite a lot of work since becoming a sports therapist, you know, working on that kind of stuff as well. And again, I spent a lot of hours outside the squash court in the gym, and I think essentially that kind of led to my interest in exercise, rehab, personal training. Again, at school, I wouldn't put myself down as an academic. I would say I struggled to kind of really get on, I think, GCSE level with anything that I really wanted to go into. It was always sport and probably biology. But again, as soon as I think I got higher up in my squash career, and obviously had the experience of massage and rehab stuff, I kind of thought, I think it was pretty clear that I wanted to do sports therapy. So that was really nice, because a lot of family and friends and other people, you know, struggle with what they want to do. And for me, they were all quite like, oh, you've just had quite a clear pathway through what you've wanted to do, which has been really nice. So if I go on to the next slide. So if we go into a little bit about, so this is kind of very rough, because again, age, I think I was wearing my orthotics full time for a couple of months maybe. And I think that I remember doing, I put in there, I religiously did the exercises, because I should probably say that.
Always says they do them.
But I think I did actually, because I was so into my squash at this point, and this is probably, again, coming up to being 13, 14, 15, I was playing nationally. So I was ranked within the top 10 in England between under 15 and under 19. So I think my highest was number 2 in England, and I just missed out on playing for England in the squad, because I actually got glandular fever. So that knocked me for 6. But I think because of being high up where I was really, really determined mindset wise to really do the exercises, you know, be following everything I was told. And it's kind of just molded into, again, what I do today personally. So again, with me myself, I continue to kind of strengthen my feet, my arches, my ankles. I try and do as much work with my lower body as I can, as well as wearing the insoles, because as I became a sports therapist, my thought process started to obviously develop and think, should I just be wearing these and not doing anything else, or should I be, you know, trying to, you know, do some other things as well? I still play squash today, obviously hardly at all in the last year because of COVID reasons, but I play now just at a local club level, and actually was playing in men's teams, because at the club I'm at, there isn't really many ladies teams around. But yeah, I think, as I said, fairly straightforward path for me, and I was really interested in biology and PE, and it's also kind of what led me away from a physio degree as well, which again is a whole nother discussion, and that's changed a little bit as I've kind of gone through, you know, university and my journey in the last 7 years. Pros and cons, I think, but yeah, again, another discussion, I think. So if we go on to the next slide. So yeah, I would say it's definitely taught me, even before studying as a sports therapist, that kind of the pain you have isn't always what it might seem. So again, I had bilateral knee pain, and obviously at the time I was saying, you know, it was actually my medial inside of my knees that hurt. And I think that kind of taught me when I went to see the podiatrist that, you know, it was actually coming from my feet. and not essentially from my knees. So, you know, it wasn't really true knee pain as in I'd done any damage to my knee joints. I think I might have some wear and tear now, but the issue essentially was my foot biomechanics. So that's been really interesting for me. I think as my journey through being a sports therapist, I think I've learned to kind of look at the body as a whole and see how our bodies function together. You know, if someone's got shoulder pain, I do assess the shoulder, but I tend to look at, you know, depending on the history, depending on what they tell me in initial assessment, I'll be looking at the neck, I'll be looking at maybe further down the arm, I'll be looking at the rest of the body. And I think that's, again, obviously we're taught that kind of thing as a sports therapist, especially on the graduate course. But I think probably I learned that really early on from kind of my experiences playing sport to that higher level. So it's kind of, I've just used it in my practice today. So obviously the pain a client presents with, take it at face value, but I always try and take it with a, you know, a pinch of salt. And I try and investigate as much as I can, higher and lower, to find out, you know, if it's actually coming from that area, if it's coming from somewhere else, you know, if there are several things causing it. So yeah, I think even in our current time, I still love being a sports therapist. And I think the knowledge that we were taught degree levels helped me, you know, with hundreds of people over the years. And I've picked up interest in definitely some other areas, as well as kind of, obviously at the moment, I love MSK and assessment and injuries, but again, done lots of work with more neurological stuffs and nerves. So that's been really interesting as well. If we go on to the next slide. Okay, so I'm going to leave you guys with a bit of a kind of a case study of myself. So the past sort of, I would say 18 months, 2 years, maybe 2.5 years, I decided to wean off my insoles. I wasn't really sure why I decided to do this, but when I worked at I'm not going to mention the place actually, but when I worked somewhere, they were taken over by a company, and it was great because the company meant that we had a director, and all the clubs were kind of linked. So we ended up doing training together. And I remember at one of the training sessions, we were sort of talking about foot biomechanics and insoles, and I said to, he was a physio, and I said to the physio, we were doing some, you know, training in the gym, there was probably about 12 of us, all sort of sport. I think maybe I was probably one of the few sports therapists and all the rest were physiotherapists, but I remember asking him, you know, do you think I'd ever be able to not wear sort of insoles? And he was kind of, I mean, not sure if he really wanted to answer it or not, but he sort of was basically saying no. And this was quite a few years ago now, but I've got kind of collapsed arches, transverse arches. I've got quite a lot of things going on. And I don't know if sort of years later as a sports therapist, this was sort of a bit of a personal challenge for me. I have been playing squash over the last sort of, you know, 18 months, 2-3 years without them, and running without them, and walking. And I haven't really had any issues for quite a long time until the lockdown. I sound like my clients really, actually. So I started off with kind of right knee pain, which I also have a guy that I use for sports massage on myself. And he kind of had a look and said that I had done something to my hamstring initially, and that's why he thought I had knee pain. So again, I did all the correct stuff for that, and that sort of went. But I've had left knee pain sort of ever since, I think, start of the lockdown, when I was maybe running a little bit more without insoles. And then really I've stopped running for the last 8 months. I've just been doing walking, sort of yoga, sort of HIIT stuff, but I have been doing lots of strength and stretch work. I mean, I know what I should be doing, so I've been trying to do as much single leg stuff as I possibly can, along with, you know, core stuff, glute stuff. And I've tried running since, so probably in the November lockdown and this lockdown, I have been running, but I just can't get sort of past, you know, like a K without, you know, sort of having, I wouldn't necessarily say knee pain, it's probably more sort of like something doesn't feel right, like it's not in place. So I will probably leave that with you guys, thinking whether I should be putting my insoles back in for running and running with them, or whether there might be another issue going on. I put this together a little while ago and I have been experimenting since, so I have got some answers, but I'm gonna leave that for when you guys get to watch this, and then we'll maybe carry it on as a bit of a discussion, I think, afterwards.
Okay, I've got a couple of questions on the back of that then, because there's quite a lot in there. So firstly, I think mine and your journey to being a sports therapist is very, very similar. I had knee pain when I was 14. It was growing pains, and then I went away and did a H&D, which had a sports rehab bit on it. I never knew what sports rehab was or sports therapy. And then they were kind of having a look and go, oh, you've got this.
Yeah.
But I'd been dealing with this for about 5-6 years with no answers or anything.
So it sounds like you were dealing with it for quite a lot longer than I was. I think mine was picked up quite quickly because of the high level of sport I was doing. And that was my thing. If I hadn't been playing high level sport, I don't think it would have, my journey might not have been the same. So quite interesting.
With regards to kind of the exercises, so you said you're trying to kind of wean off a little bit and use exercise. So what kind of exercises do you personally find help you for kind of foot, ankle strength?
So I'm going to talk a little bit about, if I just speak about, because I'm hypermobile, I found from quite a young age that sort of weight work really helped. So again, for me, I like running, but I'm more of like a 5K girl, you know, in like half an hour. That's probably, I'm not, you know, 10K marathons. I'm not kind of like that. So I've always done a lot of strength work, and I've got to lifting quite heavy, really, kind of with, you know, not really heavy, but sort of, I found that it really helped overall with kind of just my feet kind of doing, you know, hamstring work, glute work, quad work. Some things that I've done for my feet recently, I tend to do quite a lot of so like trying to get my arches, you know, activating a little more, try and get my kind of toes, because I really struggle again to use my toes individually. So things like picking up pencils, picking up marbles with your toes, I used to get like towels and try and, you know, get my foot to bring them in, pushing the soles of my feet together, just doing some isometric contractions, just holding them together. I do at the moment, because I find my feet have got tighter without the insoles, so doing a lot of kind of rolling a ball under my feet. I find as well my calves tend to kind of struggle a little bit, so as soon as I tend to roll under my arch, my calves sort of release. Calf raises as well, do quite a bit of them. Trying to really think what else recently I've done. Early on, so probably not recently, I did a lot of TheraBand work, so kind of just trying to get the movements of the ankle resistance with the TheraBand. Trying to think of anything else really that I've done super recently. Not loads, but I think probably over the last 3 years, probably done most of the foot rehab that's kind of out there, as well as kind of like balance work, single leg stuff, just pretty much everything you can think of. I've probably been trying to build up and just figure out where there might be issues. Yeah.
So with regards to the orthotics, you said you've obviously had them quite a while.
Yeah.
So how often have you kind of changed them? What kind of orthotics are they? You know, how many times have you been reassessed, that kind of thing? The reason I ask is because, like, obviously we see a lot of people who, you know, with kind of overly pronated feet, you know, flat foot, whatever people want to call it, but the asymptomatic, you know, but people seem to, you know, oh, well, we need to sort this, but there's nothing to sort. And I think obviously with your kind of hypermobility being present as well, it's probably a combination of a couple of different things which have kind of exacerbated your problems with that. So with regards to orthotics, how often have you changed them? How have you found the process?
So I'm going to be an awful therapist now, but I'm going to admit that I had these made. I'm adamant that it was a little bit later than that. I thought I was about 14 or 15, but my mum thinks it was, I don't think it was 10 or 11 looking back, because I've still got the same insoles.
Wow.
So they're full length, and they still fit me. I don't seem to have any. This is why I think it must have been later, because it must have been when my feet had stopped growing, because I haven't had any issue with them. I mean, they were really well made, so they're not,
Clearly.
you know, yeah. Well, the kind of end of the toe bits are coming off, but I was going to grab them for you, but I don't actually have them within reach. But they're again, they were probably at the time about £300. So they were sort of, again, taking a mold of my feet in plaster. And I actually don't know what make they are, but they've got still underneath, they've got I might send you a picture after so you can have it, but they've got my name underneath them, and so all my support is kind of medial arch, and I've also got a little bit of a heel lift as well, but it's very, very solid. So even over, you know, what am I now, 29, so like 15, 20 years,
wow.
They've kind of, yeah, it's a long time though. So this is me maybe just being, because I've not had any issues with them really until I stopped kind of wearing them. And then I was thinking, should I be wearing insoles my whole life anyway? Like, I'm sure there's, you know.
Do you think it's become a little bit of a psychological barrier for you now? If you've had the same ones for kind of 14 years?
Yeah, I mean, potentially it could be subconsciously. I feel like consciously not really, because the past kind of 18 months, 2-3 years, I haven't really had any pain. So when I've been playing squash and running and doing so walking, I wasn't expecting to have any problem, because actually when I walk, I'm not really loading enough, and I can see that I can kind of keep my feet in a fairly neutral position. But I have been, for the past 2 or 3 years, running and playing squash pain-free. I've not really had any problems. It's only been 2-3 years down the line, and I'm thinking, has that contributed to maybe other things like not going to the gym as much, the gym's not being open. Obviously I don't have lots of weight stuff at home, so it's more been, you know, body weight stuff and HIIT sessions. And I have noticed probably just a whole body, you know, maybe feeling tighter, stiffer when I haven't done as much weight work, so as much gym work, which is quite interesting. But I should probably be getting a reassessment of my insoles at some point.
From a therapist point of view, I mean, if you kind of put yourself in a therapist seat and you were a client attending your clinic, how would you approach that kind of?
Yeah,
it's a difficult situation, isn't it? Because like you do things yourself, but then if you take a step back and kind of look at it from a therapist to client point of view, you'd probably kind of shout at yourself a little bit.
Well, exactly. I think that's the problem. I think as a therapist, I would be, you know, tutting and whatever else at my client if they came in with the same thing. But I think probably because I'm a sports therapist and because I know what I know, I think I probably use that a little bit and mainly because I've not had any issues. Over 14, 15 years, I've not really had any issues until this like March. So I think if I was having constant issues, that might have pushed me to, you know, if they weren't comfortable to wear them, if, you know, I was having ongoing problems for years or, you know, months and months and months, then I maybe would have. I think I probably, just because there's not been any issues, you know, with most clients, if they're not in pain, they stop their rehab and, you know, think everything's better. But yeah, it's kind of made me think maybe over the past year, especially, to really have a think about, now I've tried a few things out. I won't give too much away because I want to see if we can get some answers on the case study as well. But now I've tried some things out, I can kind of give a bit more detail on that at another time. But it makes me think, should I be getting them re-looked at? Should I be doing other stuff? It's kind of, for me, it's I think definitely another assessment whether I'd want to wear insoles for doing certain things. I think it's just a little bit of stubbornness as well.
It kind of goes back to, if it hasn't given you any problems, then don't change it.
Yeah.
I suppose your problems are kind of changed when you've had a period of inactivity and then you change your activity levels again. So
yeah, could be more that than the insoles.
So is it insoles that are causing problems, or is it kind of you've pushed yourself, as you know, a bit too much and loaded some tissues a little bit heavier than what they've been used to? So kind of you've had some sort of reaction there. I think it's quite insightful. It is insightful because, I mean, as therapists, I think most therapists have had a multitude of injuries and stuff like that, and kind of draw on experience. And I think yours is quite an interesting one because it's a controversial topic. It's quite, people champion them, some people. It
is a really interesting one. And the only thing that I would say is that probably over the 8 months I stopped running because of the left knee issue. The only thing I would say that's different is that if it was a client of mine, normally they come to me and they just go, well, I've stopped running and I'm resting, I'm not doing absolutely anything, which, as we know, it doesn't really help anything. So the difference I would say for me is that over the 8 months I've tried to do pretty much everything I know as a sports therapist to work on the weaknesses, the imbalances, kind of. So I did quite a lot of work for 8 months, and having a little bit more time, not being able to still, I didn't have any problems walking, HIIT, sort of yoga, doing anything else with my knees. So it was really only running. So I decided to just lay off that, really work on the other stuff for kind of a long while. And then interestingly, when I did go back to running, same thing, still before the first K, nothing had really changed, which I was just like, this is really frustrating because it's not, I feel like I've probably got as much knowledge as I probably need to have. I've chatted with a few other therapists as well to run through what I'm doing, seeing if I'm missing anything, trying a few other things. And it's been, an interesting one for me because it's, normally I like, it's always more difficult, I think, to solve things on yourself than it is on clients. So it's good to, step back, and that's, I've got.
Yeah, we don't make the best patients, do we?
No, definitely not.
Definitely don't make the best patients. I know I don't. So no, it's been good chat. I think following up with the case study thing, I think it'll be quite interesting. So I think that should get some debate going. So
I just want to hear people's thoughts on insoles, whether they think, it's all in my head maybe, and I need to just, not wear the insoles and run, or wear the insoles and run, or it's just, I'm interested to hear some other things. As I said, I put it together a while ago, so I have got kind of an end, hopefully an end sort of to it, but I will wait and.
Well, I look forward to that bit. I look forward to hearing the outcomes of it. So if people want to find out a little bit more about you, I'll put some stuff up on screen there. So where can they find you?
So you can find me on my website. That is www.ewsportstherapy.com. My Facebook, which is just at EW Sports Therapy, or my Instagram, which is EW_sports therapy. I'm on a lot of these pretty much most of the time at the minute. So if you've got any questions, or you want to have a further chat, or you've had any similar issues with knees, then I'd love to get in touch.
Most people can also find you you have a Facebook group for the regional group down south as well. So what's that one?
So that is, I think that's titled just, actually I don't know what it's titled. I think it's South You might have to.
I'll put a link in the description.
Yeah, that might
so
be better.
I'll bring up a link. So off the top of my head, I think it's Sports Therapy Association Southeast.
Yeah, something like that.
So yeah, so any members down south, southeast region want to join the group, I'll put the link in the description for you. If you want to find out any more about, sorry?
I was just going to say, we have got as well, obviously it's myself, and we've got another regional rep for the Southeast who is Joanna as well. So Joanna Hoddinott, so you can get in touch with either myself or her.
Thank you very much. If anybody wants to find anything more out about the Sports Therapy Association, you can find us on Facebook. So we have several pages. So we've got our open page, we've got our group page, and our members only page. We are also on Instagram, Twitter. Our YouTube channel is getting quite busy at the moment. So we've got lots of stuff on there. And you can also find us at the sta.co.uk. If you want a little bit more content, feel free to check out our Tuesday talks with Matt Phillips. They're every Tuesday at 8 p.m. We have some great guests on there. If you want to contact me about anything, my name is Scott, and you can contact me at Scott@STA. And thank you very much for listening.
Thank you, guys.
Thank you, Emma.